That rate is like a 3-hour rate.
Really?
That's a 3-hour rate, yeah.
Okay. I'll up it in a little bit.
He's worried.
He's like, oh.
Welcome to the Alfi Podcast, episode 13, with a dear friend and guest, Kelly Giselle Vasquez, nurse practitioner for 10X Health and Gary Brecka. Kelly, let's start with, what are we doing here today?
We're doing NAD plus today. We started on a lower dose just because it's his first time. She's a pro, but we started with 200 milligrams. Normally, we do 500 milligrams if you get the full dose. You could go up to 1,000 milligrams within a week. So it just depends how you tolerate it and how you deal with it, basically.
Cool, we're going to find out.
Slow and steady wins the race.
And we're going to talk about biohacking. We'll get
Yes.
jaw surgery into the mix. Y'all know that I'm interested in biohacking as it relates
Yeah, sleep apnea.
to
jaw
yeah,
sur- jaw
exactly.
surgery, yep, great.
I do say that jaw surgery is the ultimate biohack because we can increase breathing and airway. But what I'm really interested in is two parts. One is, can we use biohacking to help our patients recover better, get through surgery better? And I think the answer is yes.
Oh, definitely. What, like, the definition of biohacking is to use technologies, different things, whether it's diet, exercise, to improve your health.
Mm-hmm.
So it definitely will help you recover in any surgery, not just jaw surgery.
Yeah, and that's the second part of it.
Yeah.
Not only in terms of recovery, but jaw surgery is one piece of the puzzle. If someone needs to breathe better, that's one part. But you still have to do everything else right.
But everything, everything correlates. So it's like you're breathing better. If you're breathing better, then you're sleeping better. If you're sleeping better, then you have better recovery time. So if you're recovering better, then you have more energy to get and go through your day and get through those tasks.
Exactly. Let's talk about why you went into nursing to begin with.
So I actually had open heart surgery when I was 15. The saying goes, you never really remember who like the person was that helped you. You remember what they did for you. But I remember both very vividly what I went through and who helped me. His name was Alex. It was a nurse. I don't really know his last name. I just remember him. I had the surgery when I was 15. I had a congenital heart disease. So up to 15 years of age, I was passing out, I was seizing, I was short of breath, I was cyanotic. I used to live at the hospital. They already knew who I was there. So I guess that whole journey of like going to the hospital, having the nurses help me, having doctors examine me and trying to figure out what was wrong with me kind of led me on that path of like, I also want to help people. So at 15, I had my heart surgery, and one of the things they said was you probably wouldn't have recovered as quickly as you did if you weren't so active. Because I used to play soccer and I danced and I competed. So I was very well trained and athletic, and if it wasn't for that, then it probably would have taken me much longer to recover. I finished high school. I went to nursing school. I started working at the hospital. I worked at the hospital for about 7-8 years. I did like 5 years post-op. So I used to get the cardiac patients. I used to get cancer patients, mastectomies, CBIs, platelets, blood transfusions. And then 2020 hit. And I went into COVID ICU.
This was here in Miami.
Yes, that was here in Miami. Then I get a call from 10X. Just seeing and being on both ends. Because when you work at the hospital, you're being reactive to all these diseases. Like these people already have everything. They already have the heart disease. They already have the diabetes. They already have all these pre-existing medical conditions.
Right.
But then I was also on the other side of being proactive about it and having people that are young that just want to better themselves and don't necessarily have anything wrong with them. They just want to be optimal, functional, and live a longer, healthier life. I went full-time with 10X, and then I started working with Gary, and it was up from there.
It's really fascinating, the things that you said. One of them is that dichotomy between taking care of people that have already developed diseases and are sick versus what you're doing now, for the most part, taking people that are really trying hard to prevent illnesses and stay as healthy as possible. The interesting thing is that I feel like, at least in this country, 99% of healthcare is on that other side
The
of it.
reactive side.
It's a reactive side, you know. Most of the money spent on healthcare is on the reactive side. I went to medical school and dental school, and everything I learned was on the reactive side. Very little time was spent on keeping people healthy and preventing illnesses. But now you're on that, I would say 1%.
Yeah, and it's pretty cool. I feel like, I don't know if it's so much that it's that I'm more aware of it because I'm in it, or I just feel like in general, at least our generation, I feel people are more aware and they're more willing to make the change. Because like my parents, my grandma, my mom, my dad, like they don't really know anything about this stuff. Like
Right.
it's just like, oh, you're hungry, like go eat whatever's in the fridge, or like, oh, you're hungry, go eat the cereal, or you need breakfast, go eat cereal. Oh, I don't feel like cooking today, like eat cereal. But like they weren't aware that a lot of these things were not beneficial for us. So I feel like our generation now is more aware and willing to make the change. And now our generation's having kids and they're really watching what they're feeding their kids, what's going into their bodies, what they're cleaning with, what detergent they're using. So it's actually really good and cool to see.
Yeah.
I would argue the same thing, that like our generation's very different from our previous generation, because I see it all over. Like I spend a lot of time on social media and I see it all over social media, and a lot of people our age are more health focused. Our generation doesn't really drink alcohol anymore. They've kind of just cut it out. Like we actually went 0 alcohol a year ago, and we've been doing
Same.
we've been doing no alcohol at all, and it's like your entire life completely 180s when you cut out all of those toxic things that you shouldn't be consuming anyway. But it's very interesting that there's a very small shift into the direction of health, and it's very slow and steady, but it's there and you see it, and people are making healthy decisions now.
I feel like now there's more noise about it. Like,
Definitely.
like people are wanting, like, I feel like before it was cool to like just go out and party and like do all these like crazy
Destroy
things.
your body.
Yeah, and now it's like, let's train for something. Let's do a marathon, or let's go work out in the morning. Like it's a completely different vibe, I would say, and a change, and it's a positive one, which is good. And it would be interesting to see, like, do we outlive our parents? Are we going to have better quality of life with these changes?
Yeah.
I think for me personally, it's more about better quality of life versus like living longer. Because in my opinion, if you are unhealthy, it doesn't matter how long you live, you're going to suffer. But then if you take care of your body and you have a better quality of life, like, yeah, you can die tomorrow, it doesn't matter, but at least you lived a good life and you're not suffering through it all.
Sure.
Just so much harder when you've got things, health issues.
I've seen both sides, so definitely right on that aspect.
Yeah. Everybody dies, not everybody lives. But I do think the pendulum is swinging, for sure.
Yeah.
You're right. 10, 15 years ago, it was all about partying and drinking. And now really the trends are going away from that. And I love it.
Yeah, like not drink. Like I did the same thing. I didn't coincidence last year. Like I decided to like cut back on alcohol and not drink. And it's not only that, but there's like different alternatives now. Like when my parents were my age, like there wasn't adaptogens and like things like that, or they weren't aware of them. But like now it's like there's a different alternative if you don't want to drink. That kind of gives you like that same like mellow feeling, like theanine. But we have options now. Before, I feel like maybe there were the options, but they were never really spoken about and they weren't used.
Yeah. definitely. So less bars and nightclubs opening up, more health spas, sauna,
Yeah.
IV drip places, and really biohacking.
At least here in Miami, it's booming, but
Yeah,
I don't know about Texas.
yeah, it is for sure. They're popping up everywhere.
Oh yeah, so many med spas.
Yeah, and just things that boost quality of life. Sleep being a huge one. You know, I'm wearing an aura ring. She's got an aura ring on.
I have one too. Mine's charging. Sorry.
Yeah, I know you're familiar with the 8 sleep bed.
Yes, of course.
I know Gary talks about that.
Yes.
We got one of those. It's awesome.
Yeah.
Yeah, it's
That's
awesome.
cool.
But you know, the biggest thing is prioritizing sleep. It's, I think, such a huge biohack. We spend a third of our life at least asleep, and we don't think about how important
No,
it is.
it's super important. Like my life just went like because I used to be night shift. So I used to work from 6 o'clock p.m. till 7 in the morning. And no matter what they say, the sleep is not the same.
No,
Like sleeping
it's
in
not.
the morning is not the same. And I would get home at 7, shower. I didn't want to eat. I didn't want to do anything. I would literally just go to bed. But then it's okay, 9 to 10, 10 to 11, 11 to 12, 12 to 1, 1 to 2. I would sleep
Yeah.
like 5 hours and then I had to go back to work. And I was always moody. Like, you did not want to talk to me. I was having a lot of gut issues.
Yeah.
My gut was just not happy. And it all started when I started the night shift. Like the circadian rhythm just went,
Yeah.
not it.
Well, and also for women, like hormonally, you're supposed to be getting anywhere between 8 to 10 hours of sleep. That's how we function optimally. Whereas men, I think it's 6 to 8 hours.
Yeah.
So if we're not getting the right amount of sleep, it's going to ruin everything. And especially for us, I feel like women are a lot more sensitive because our hormones run on the cycle of the moon, whereas men's hormones run on the cycle of the sun. So because of that, we need a lot more sleep to regulate our hormones. And if our hormones are out of whack, our
Then we're moody.
we're moody and digestion's out and everything's just like upside down.
I'm not going to comment. All right, so what's in this yellow bag over here?
Okay, so right now that's the 10X cocktail. So the 10X cocktail has B complex, magnesium, calcium, vitamin C, and then after we'll get like a B12 push and a glutathione push. Glutathione to like help detoxify your liver, and then we have 200 milligrams of the NAD. So essentially, the NAD is going to help with like circadian rhythm, DNA repair, metabolic health, and mental clarity. So you should, if you're having like any brain fog, you're like, what's going on? Or like, what did I come in here for? You should definitely feel more alert and more energized after these trips.
NAD is interesting to me because it's a coenzyme.
Yes.
And it's supposed to help ATP production, so energy production. And NAD is present in every single cell of our body. But as we age,
It starts to decline.
it starts to decline. So maybe a direct correlation with energy levels and health in general with aging. Obviously, there's not a lot of data in this. We don't know scientifically.
And I also I tell my patients I know there's a lot of people that don't like IVs and they're like, I don't want to do the NAD, or they just don't want to do the microdosing with the injections. So another good alternative is NMN. NMN is the precursor to the NAD.
Right.
So that comes in oral form, and I feel like that would be also very beneficial too if you don't like getting stuck or needles.
Yeah.
Question about that. If you're taking it as a supplement, like as a pill rather than an IV, because obviously with IV you get direct benefit.
It'll take a little longer to
Yeah.
kind of see the benefit. But again, slow and steady wins the race, and you're still taking it and you're being proactive about it, and not just okay, well, I don't like IVs, I'm not going to do this. There's still an alternative for it.
Yeah. And even though there's not a lot of scientific data yet, I know we just talked about you guys are doing surveys.
Yeah, we're trying to get just more info on the patient just to make sure that you're improving. A lot of people, obviously, if they're spending the money on these things, they want to see that that they see a result.
Right. Everybody wants data.
Everyone, and you want a result. Like if I did it today, do you feel better tomorrow? Do you feel better in a week? Do you feel the difference in 2 weeks? Do you feel the difference in 3 weeks? Okay, you felt the difference in 3 weeks. And we did a certain dose. If we give you more of a dose, if we give you 400 milligrams or 500 milligrams, is that going to last another 2 weeks? Is it going to last another 6 weeks? Like, we want to know that information.
Right. And we know it's temporary because it's a coenzyme. So our body's going to use this NAD up pretty quickly. But what's interesting is there an indirect mRNA gene expression change? You know, because our bodies have, our DNA is coded, but there are things that can stimulate or change these factors to work better. So that's interesting to me to see how long do I feel different. We'll let you guys know. That's what I'm curious. That's why I'm doing this. I want to see. Episode 16. Do we feel different? And
From experience, because I've done this before, you do feel different.
okay, so that's the other part. There's a lot of anecdotal information going around about people that have had it done and say that they do feel, like you said, you've done it.
He's going to be doing cartwheels out of here. Wait, what's your surgery time? What's your surgery?
Record is 39-minute double jaw.
He's going to be doing it in 35.
We'll get back to you on this. We'll see if we break some more records. But I'm really interested to see, because not only for its effects on sleeping better, feeling better, biohacking. I'm very interested in biohacking. But like I said, you know, can we make the surgery recovery better? We've taken an 8-hour operation and got it down to under an hour.
Beast.
But it's still an operation that people have to recover. It's not an easy recovery. It's easier when you have a 1-hour operation compared to 8, but you still have to go through that wound healing and difficult parts. So now I'm really interested in what can we do to optimize the recovery and healing. And we're trying this actually in Houston. We're working with Dr. Ron. He's a functional medicine doctor. And for some of our patients, we've already started trying pre-op and post-op IV, NAD, and micronutrients.
Have you seen a difference?
Too early. This is new, but I'm interested to see, even subjectively or anecdotally, what does that recovery feel like for these patients, and hoping that we start getting these things better.
Are you doing just like the NAD itself, or are you also doing it with like the vitamins?
Yeah.
I have a question about that. So obviously you would want to incorporate this in for patients to help with healing. Do you think it would be an overall anti-inflammatory effect, or do you think it would be more of like helping the bone cells regenerate a little bit faster so they can heal faster? What is your take on it? What do you think?
I'll tell you my take, and I'm interested to see what Kelly thinks. I mean, the claim on NAD is that it's boosting energy production in the cells, which should help with wound healing, with the immune system, so with inflammation. And also one of the parts is neuroregeneration, which we have some numbness, for example, in the lips. That's usually temporary. But neuroregeneration is really interesting to see if maybe we get numbness down, right? So there's a lot of components to this.
Have you added like red light to your patients, like recovery?
Yeah, we recommend it. I haven't officially started as part of the recovery, but we have plans to do red light, hyperbaric oxygen, maybe even the ozone chamber.
Yeah.
I think for recovery. So I'm very interested in building this. It's in the pipeline.
Ozone IVs. I think that would be beneficial to fight off bacteria, fight off infection, anything. I think that would be pretty cool. I don't know anything about jaw surgery. Sorry, guys. But how does that work? Like, you literally keep them shut? Like, they can't intake anything, or like, how does that work?
Yeah, so traditionally with these 8-hour operations, a lot of patients were wired shut or banded shut. We use custom plates. So basically, in that hour, everything's pre-planned on a computer. We're breaking the jaw, repositioning it, and we print 3D custom titanium plates to hold the jaws in the planned position. And that's all inside the gums, directly on the bone. So when the patient wakes up from surgery, they're not wired at all. They don't even have braces, a lot of them. We can do it with Invisalign. So they can talk, they can eat. Besides the swelling in the first couple weeks, they look fairly normal.
Eating is like soft food, soups.
So it should be non-chew for the first, I recommend 8 weeks of non-chew diet, and most people do protein shakes and soups and liquids.
Check your protein shakes. What are you intaking?
Yeah, exactly. Exactly. Make sure it's clean. Interestingly, I did the surgery for my brother 7 weeks ago. 7 weeks ago. And he took non-chew diet to a whole nother level.
Why? What does that mean?
He has been very compliant.
Okay, that's good.
Johnny's been compliant. He has not chewed. But he will eat everything. And so, for example, we went to Milos yesterday.
Can you blend that for me, please?
Yeah.
Did he?
No, we went to Milos. We ordered a ribeye. He ordered a ribeye. But he'll sit there and he'll slice it so that it looks like truffles.
No way.
He'll slice his food paper thin, and he'll just swallow it. And he'll say, "Look, I slice this with a knife and fork better than you do with chewing before you swallow." And he was right.
Oh,
When I chew, I swallow bigger chunks of steak than what he was swallowing. So
I need to get your brother's cutting skills then.
yeah, but he's figured out the life hack to the non-chew diet.
Yeah, like he's literally eaten everything except for bread.
Oh,
Everything.
wow.
Like I watch him eat and he's just cutting it into the thinnest, smallest pieces, and then he's putting it in his mouth and he's just swallowing it.
And I think that he's had the easiest recovery that I've seen from any patient.
How much time does he have left?
He's got one more week, and then he could do a soft chew. We're going to Carbone tomorrow night again, and he said, I can eat everything on that menu.
I thought you were going to say, like, he was asking things to be blended for him so he could intake it. I was like, whoa.
Yeah. So he's done really well with it. Most patients are afraid to do that, but his recovery has looked different. People ask me, did you do anything different for him since he's your brother? And no, the answer is no. I operate on him and gave him the same protocols as every patient, but I think nutrition has been a big part of his recovery.
I would argue the reason that people are so scared to do that is because number one, they don't trust themselves not to chew. Because, like, obviously when you have food in your mouth, you would think like it's just an automatic thing. So I think Johnny subconsciously and consciously makes an effort to not chew. Like, he's constantly reminding himself not to chew. But I think the other thing is, like, they're scared of choking, obviously, because a lot of our patients who come in for jaw surgery, they have a hard time swallowing pills to begin with, even before jaw surgery. So, like, having that ability to finally have, like, more space in the soft tissue post-surgery is weird because they're so used to having that limited space. So it's harder for them to adjust.
Yeah, it's true. Things that people don't think about for jaw surgery patients is, when the jaw is small, which most people today have small jaws. Most people, you guys are the exception. Most people, their jaws are too small, and they have sleep apnea. They snore. That's not normal. It's normal because a lot of people have it, but it's not healthy. And they have a hard time swallowing pills. How many times have you heard someone say that they have a hard time swallowing pills? And that's not because their tongue is abnormal or their swallow reflex is abnormal. It's just that the space behind their tongue is so limited. So that's a huge sign. If you have trouble swallowing a pill, you're probably snoring. You're probably not breathing well, sleeping well. And that translates fast forward to so many chronic illnesses that people end up with in their middle to later ages. High blood pressure, prediabetes, diabetes.
I never thought of that. I have a lot of patients that are like, can you give me the liquid form? I can't swallow pills.
Yeah, huge sign.
Or like they open the capsules and they like dump it in their yogurt or in their food because they can't swallow it. I never actually really thought of that. There you
Huge
go.
sign. I mean, it's really the exception that someone's jaws are in a good position, healthy position. There's so many reasons for that that you hear us talk about: mouth breathing, allergies, the foods we eat that are highly processed. All these things contribute to poor development of the jaws. Pacifiers, not breastfeeding.
This may be a dumb question. Like when you work out, does it make a difference, like the position of your jaw, like when you're mouth breathing or nasal breathing, like would it make a difference?
Yeah, definitely. It's much easier to work out if you can have good nasal breathing and a healthy airway. Much better. And so a lot of our patients, one of the things is, if you're 20, 30, 40, 50 years old, whatever it is, you've been breathing this way your entire life. There's no way to know any different. Right. That's the way you think you're breathing in. This is something I hear all the time after operating on patients is like they wake up and they say, "Oh my God, I can take a breath with no effort now." And I didn't know this is the way you're supposed to breathe. And then fast forward, 6 weeks, 3 months, 6 months later, they say it's so much easier to run, so much easier to lift weights, exercise because they can breathe.
That's insane. But you go so much time without knowing this, and then
Right.
like how many years just went by and you weren't doing anything because
Yeah.
you thought that like there was something else wrong.
Right, exactly. And that's something we also hear because we have a lot of patients that are doing it now in their 40s and 50s. And they say, man, I wish I had this. I lived all these years not tapping into this potential.
Yeah, and you could have been healthier, and
Right.
you could have been 20 pounds lighter or 15 pounds lighter and
Yeah.
healthier, more active. That's insane.
Yeah. And like you talked about concentration, like we're trying to achieve better circadian rhythm, concentration, less brain fog, all these things. And that's directly tied into sleep health.
I don't think people realize how important sleep is. Like, yeah, like your doctors tell you, or whoever you go to, your primary, but I don't think people actually really realize it until I feel like now that people are like, oh, maybe I should get my 8 hours of sleep.
Yeah. Actually, the main reason for me, I don't know about you, but the main reason I dropped alcohol or my motivating factor, not that I ever drank a lot, but dropped wine at dinner or a cocktail at dinner was because it affected my sleep.
Yeah, well, if you measure with your Oura ring or your Whoop, normally you see the trends drop. So like if you drink, you'll see the trends drop and your recovery time and your REM sleep just gets worse. And then it goes back to normal on the days that you don't.
Yeah.
And I guess like it's good that we have data. I guess that's why we weren't doing these
Right.
things, because we didn't have data to actually measure it. But once you actually measure it and you see that you remove the alcohol and your numbers do improve, and not only do they improve, but you feel better, you're like, okay, well, I'm not doing that.
Yeah.
That's why I dropped it too. Cause like I was never a big drinker, but like you said, like a glass of wine here and there, or like an espresso martini sounded so good. Now, like you can't get me to drink anything. Like
For me, it was leaky martinis, but
you sleep so much better. My sleep 180 since I completely cut it out.
Something that I never really saw on menus at restaurants and bars before are these non-alcoholic mocktails. But now the mocktails
They're actually good.
they're great and they're on every menu. I never saw that before.
And another thing is like with those mocktails, it's like fresh juices. So it's like you're having a nice little fresh juice for with
And
your
they make
dinner,
it
which is
fancy, and
amazing.
they put the garnishes,
Yeah.
so it's just like you're drinking.
Right, but I would say even 3 years ago, menus didn't have them.
No, they didn't.
Right. So yeah, the times are changing for sure.
I think even 2 years ago they didn't have them.
Yeah.
I think it became like a very like recent
In this
thing,
last year?
like, every menu now has like a.
What would you say top 5 favorite biohacks?
Well, I think diet's very important, so that's considered biohacking. Exercise for sure. Me personally, if I'm not moving or if I'm not doing something, I don't know if it's because I danced my whole life, but I just like feel the need to like stretch or like do something. I don't know if I'm weird. I would actually also have to say ozone therapy. I love ozone. I rarely get sick. I don't get sick. I didn't get COVID. So like for me that's been like a game changer for me. It gives me a lot of energy. And again, people around me, I deal with people that are like sick and they're like, hey, can I get an IV? Like I need an immunity booster. Oh, hey, I've been traveling. Hey, my kids are sick. Hey, my kids are in daycare. They came back. I don't know what they have. And I really don't get sick. So I kind of really do like ozone. I do work in the space, so I have access to like a lot of peptides nowadays. So do blood work, peptides, kind of to whatever I'm feeling that I want to achieve at that moment. So if it's whether more energy or whether it's more muscle mass, I kind of play around with different peptides.
Okay. All right, let's break those down. Let's go. So you started with diet. What's the
So
what's the Kelly Giselle diet?
the Kelly Giselle diet is, if you can't pronounce it, probably you shouldn't be eating it.
Oh,
And
that's great. I like that.
And
If
I-
you can't pronounce it, don't eat it.
I don't have like any, they don't pay me for this or anything like that, but I do use the Bobby Approved app. So like when you go grocery shopping and you click
Yeah.
like the QR code, it tells you like if it's good for you or if it's not good for you. I put like a lot of my patients on that because like they didn't know.
What's
And
the name of that?
Bobby Approved.
Bobby approved.
Yeah. So you scan the QR code, and what I like about that app, I know there's different ones, but that's just like the one that I use. You scan it, and once you scan it, not only does it tell you that it's not approved, it tells you like the ingredients that it has that makes it not approved. Like it causes inflammation, natural flavors, you don't know, that could consist of 20 different things, 200 different things.
Yeah.
Then it also gives you like the healthy alternative for the thing that you looked up. So like let's say I scan popcorn. Maybe that one wasn't approved, but there is a healthier alternative. There's probably like 5 of them that are approved that you can't pronounce what you're eating. So I do like to use that app, like going grocery shopping and stuff. And I put a lot of patients on it.
Cool. It's a good thing I can pronounce Wagyu ribeye. All right, your second one was exercise.
Yeah. Well, I've just been active like all my life. So I played soccer, did dance, still teach to this day. So I don't teach as often, but I'm always moving. And I feel like that's very important because like once you become sedentary, like I think that's like a loss, especially when you're older.
Yeah, I think adding to that, the sedentary lifestyle is very dangerous, and that's why a lot of like older people, once they retire and they stop working, they end up just like living more of like a sedentary life, and that's why they age so much faster than those who continue, moving their bodies in any shape or form, like even if they just walk.
Yeah, and I
You
feel
know?
like now there's just so many options. Like people, I don't know, some people might be very like focused and working out and like they think running or like they have to do heavy weights or anything like that.
Yeah.
But it's not, it's just move.
Yeah, like just walk, go on a walk.
Yeah, walk. Like I like to dance, so I dance. There's Pilates, there's
Yes.
bar classes, there's spinning classes. There's like something for everyone.
Yoga.
Like, you just need to move.
If you don't even want to like exercise, yoga.
You're moving, you're stretching, you're moving your body.
Yeah, your body
Blood
needs
flowing.
Yeah, your body needs that. And I would say at least 3 days a week is
Yeah, for
like
sure.
the minimum.
Yeah.
I think if you're not moving more than that, I mean if you're moving less than 3 days a week, you're really doing a disservice to your body.
I tell patients, if anything you do today, just walk.
Yeah.
Start walking. 30 minutes.
Yeah.
Walk. Move. You'll feel so much better.
And it's so pleasant.
Yeah. And like you don't even like walk with somebody that you want to talk to. Like leave your phones. Like have a conversation. Be present. Stay
Right.
present. But like I feel like now it's just like everything is like phone and it's just like take those 30 minutes just to kind of disconnect
Yeah.
and worry about you.
Yeah. In terms of surgical recovery, these things are so important. So important.
And
Like,
they're basic.
yeah, basic diet and exercise. People that get out of bed, the sooner the better, work on nutrition, they heal so much better than my other patients that are more sedentary, have a harder time with nutrition. It's night and day. And I think that translates because surgery, it's really the test for the body for healing, but it translates to just normal living because the body's still being tested every day, just from daily living.
I don't know if you saw like the Netflix show, the Blue Zones.
I haven't seen that.
Yeah, so like it's just
Is that about like
like the oldest people.
people
living.
like in Greece
Yeah.
that live longer because they're
But it's just like
Yeah.
daily things. Like the people in Japan or the people in Italy, like they live longer and they have better quality of life. Not necessarily because they do extreme things or they're lifting like massive amount of weight. It's just their everyday is like the healthier choice. Like there's no escalators, so let me take
Right.
the stairs.
Yeah.
Their plates of food are not ginormous. They serve themselves on like smaller plates because it trains their mind to say like, hey, I'm eating my full plate, but my full plate is small. Not how we do here in the United States that our plates are like ginormous. I'm Hispanic. I'm Colombian. So I was taught you're not getting up from the table until you finish your dish.
Yeah.
So it's kind of like, well, it's not like they train themselves to eat in smaller plates, so they do eat their full plate. But here it's like we're over saturating our
overeat.
plates and we definitely overeat
Yeah.
because it's like you have to eat everything that's on your plate. But it's like your body's telling you that you're full. Why do I need to eat everything that's on
Yeah,
my
the
plate?
portion sizes in America are
Sorry, Mom.
out of control,
Sorry, Mom.
especially in Texas too.
Yeah. Yeah, we have a lot of food in Texas.
Yeah, but like in Texas too, like the difference, because I grew up in the tri-state area and like our dishes were like pretty decent. They weren't like very small, but they weren't massive until I moved to Texas. When I moved to Texas, and like one serving size was enough for like 3 people. And then you're
I
like,
don't eat
well,
that much.
yeah, me either.
I mean, we'll often share a dish.
Yeah, we will.
Yeah, same.
So Kelly, the third thing you said was ozone. What does that mean? How you're delivering ozone? How often are you doing it?
So ozone, we have a machine that we're able to get the machine into like syringes. So we're just adding an extra oxygen molecule into your blood. So essentially, we're dumping your blood, and we're putting the oxygen into your blood, and then we're reinfusing it into you. For me, that just gives me more energy, better circulation. There's more oxygen in the blood. And I kind of like Pac-Man. It's kind of going in there and taking away anything that's really not supposed to be in there.
How about that ozone chamber that I went to at Gary's place?
Oh, so that's transdermal ozone. So that's called the Hocket. So you're able to, you're biohacking, you're biostacking, how Gary says it. So you're getting CO2, so the first couple of minutes you're getting CO2, so you're helping the pores kind of open up, so you're better able to absorb the ozone. And then you have the rifts, so you're getting electromagnetic waves, depending on what type of disease or something that you want to target, whether it's mold, whether it's heavy metals. So it sends frequencies throughout the body to kind of get rid of that and detoxify.
So is that a different setting?
No, so the machine is like a 3-in-1. So you're getting the three at the same time. And then the transdermal ozone is like it's the same machine, but you're getting it at the same time. But that one is transdermal ozone. So it's skin. So we're opening up the pores, you're receiving the ozone, it's going through the skin. And you're like a little egg.
Yeah. Yeah, I remember that experience. I
I
think
should have
that
taken a picture.
I have one.
Oh, yeah?
We'll put it in the video. You're in that picture too.
Oh, okay.
I have a little eczema, and I'm pretty sure it cleared up after that.
Yeah, for sure. Yeah,
Yeah.
there's so many different settings on the machine. Anything from like ear infection, mold, stomach, arthritis, like general body inflammation. It's a pretty cool machine.
Yeah. That's awesome. Which peptides are you taking?
I actually really like the tesamorelin for like muscle, pentadecaarginate, just for musculoskeletal help. I'm really flexible and I'm like double jointed, so I have Ehlers-Danlos. So like this is not normal, guys. Sorry. So I kind of take that to kind of help support, and it's really good for like my joints. So
Are you doing injections or are you taking these orally?
you could do either or, but I do the injections. I feel like it works better, at least in my case.
Yeah.
And then the tesamorelin, just to kind of like shed body fat, it kind of gives you a little more like strength at the gym. Nothing crazy.
Yeah.
I kind of keep it very, very mild.
Yeah. I think that's a really exciting space for surgery recovery too, is peptides. We don't know a lot about it yet.
Well, like BPC 157, like
Yeah.
you could take the nutraceutical right now, and like that's really good. That would definitely help with inflammation. So that may be beneficial. Even the pantodecahydrogenate may be beneficial for the recovery time of your patient.
Yeah, this is exciting. Because I think the big, we've already got the surgery down to as quick and atraumatic as it could possibly be.
Those hands.
Yeah. Which we should ensure. But I do think that this next level is recovery. What can we do to make recovery so much easier?
I would second that, but also I think if you start incorporating all of these biohacking tools post surgery, people will have an easier time and they won't look at surgery as such a dramatic
And not only that, but
thing.
people like look at it like last resort of like, I'm gonna do this because I just can't anymore because I don't want to go through the recovery time. But if you cut the recovery time, they're not out of work and they're fully functional and they're able. I feel like you'll have more people that are proactive instead of, again, reactive.
Yeah, definitely. And we've already seen the product of that because, most of our patients are back at work after 1 or 2 weeks, and that wasn't the case with the way it's normally done.
Yeah.
And I do feel like it's definitely opened the door to more people accepting surgery than ever in the past. But yeah, to your point, let's say we cut that down to go back to work in a couple days, get that nerve recovery back in a week or two, and then start feeling normal in a week or two. I think that will totally change everything because it's really an operation that, if you put aside the anxiety of going through surgery and the realities of recovery and all these things, that probably 99% of the population would benefit immensely from in terms of biohacking and preventing illnesses. So I think we have some work to do to get us to approaching all those people and helping them, but this is very exciting to me. Top 3 things that you've taken away being with Gary that you say that you've learned from this job.
Consistency. Like, if you're consistent, you're definitely going to get a result. Like, he does these things and he does them daily. Like, it's not like one day yes or one day no, or I'm on vacation or I have to travel, or like, no, it's like a consistency. Like, he is on it. I would also say he's taught me a lot about like food and diet. Definitely, for sure. Like, people think diet and they think that they have to like restrict themselves from like a lot of things. But if you just take the healthy alternative, it tastes just as good and it's much better for you. And definitely like all his machines, like they're just like super cool. And like the Hockey, I didn't know about that machine until I met him. So I would say those are probably like the top 3.
Yeah, I'm interested in the Hockey for our recovery center also. I think that could be a good tool.
I think it would benefit you guys, yeah, for sure.
Yeah. All right, let's wrap it up with my question. Who's the best basketball player of all time?
Michael Jordan.
Yeah, I can't argue that.
Michael Jordan.
MJ, I thought you were going to go with Dwayne Wade being here in Miami.
No, Michael Jordan.
MJ.
I thought it was a trick question for a second. Was it or was it not?
Not a trick question.
Okay.
Yeah, I'm a big Kobe Bryant fan. We have Kobe in
there. It was
there.
either Michael Jordan or Kobe.
Yeah, I think they're top 2 for
Yeah.
sure. I'll never argue against MJ.
It was
the
MJ
GOAT.
or Kobe. Okay, that's why we're friends.
Yeah, exactly. Thank you so much.
You're welcome.
I'll let you know, and we'll let everybody know how we feel.
Episode 16.
Episode 16 with NAD.
I'm going to argue that we're going to feel great.
Yeah. And we'll see if we start implementing these for all our patients. I think that'll be cool.